So one of the stretches, if you're having low back pain, is to stretch the glute muscles here, the butt muscles. That can cause a lot of low back pain, possibly on one side more, because these overwork, over-recruit, and we may not be using the abs enough. Now there's various ways to stretch out the hips. If the camera is there, I'll show you. This is the best position to see. So coming from this end, this is the one that everyone knows as thread the needle. It's called thread the needle because you'll see it done this way, where you thread this hand picking up the other leg, but you'll feel it through this, in this case the left side, and to do this you'll feel that pull into the buttock, into what you think is the hamstrings, but it's actually the glute max or the piriformis, referring down, muscle referred stretch into that left leg. What we need to do here, from this position where you can see, so if you come and have a look from this position, this here, you can't see there, you have to look from this position. We want the knee to go that way and the foot to come this way. The other way to think of that is this thigh is externally rotating like that. That's the direction of the thigh, going that way and this way. So if you like, either hand pushes this knee away, pushes this into external rotation, pushes this knee away. And I'll show you that on the reverse side. Again, it's called thread the needle because often you'll see it done like this without a chair. There's a danger here of straining the neck muscles, of the neck back becoming a bit too tense. So the chair is fine. Chair is, everyone has chairs. So this is the movement. Either hand, you push the knee away from you, but what we're trying to get is this rotation through the thigh, externally rotating that way. So you could pull this leg somehow to there, to there, to there. That's the hip stretch. Now in the advanced yoga, this is showing off here, but there is an advanced position where this leg comes higher and people can even put their head, but we won't go there. We're not making this for yoga adepts and contortionists, we're making it for people with hip pain. But this is the thread the needle variation of the chair. Of course, if you have a lot of groin pain, it could be because this hip is worn. There's a loss of joint space. And you have osteoarthritis in the hip. I'm sorry about that if that's your case. But even so, with most wear and loss of joint space, there's still deterioration of the muscles. So it's good to work on the muscles. And I'll show you that variation one more time. The same position, if the cameraman is here, using something here, camera. You won't be able to see, camera right there. So this is exactly the same movement. Now the danger here is twisting, keeping your hips nice and square in the frame. So what I was doing, lying down, supine, mat work, I'm doing the same thing, standing up, the same position, standing up. And if I wanted to bend into that, I could just bend forward and I would feel it pulling through there. Of course, I could vary the height. This is a hydraulic table, it goes up and down. But you could use a chair or a stool. For good measure, it's always worth doing both sides. And I've just realized I'm tighter on the left hip. Of course, this may be into the groin. Now don't push it. If it really feels painful, you never push through the pain. You very gently wait and see if there's release. The same principle, the thigh is an external rotation. I'm getting a bite here in the groin, which means the left hip flexor is also shorter than the right, as well as the left piriformis and left glutes. Now, that's just something you can do in the office, standing up. The other thing, everyone has chairs, and these are chairs that everyone has. So one thing to notice, very many people will cross one leg over habitually in preference to the other leg. So if you catch yourself, you'll be crossing one leg over more than the other. Probably the same leg all the time. So my suggestion would be to observe the asymmetry, because it will create a twist, a minimal twist in the pelvis, a minimal muscle imbalance with a longer, if I was doing it this way, it would be a longer, weaker hip flexor psoas on this side. It would be a shorter, tighter hip flexor psoas on this side, with also tightness in the glute and piriformis. So this is almost the case with most people, that nature does not believe in symmetry. Most people have some marginal imbalance, and then you wonder why it hurts on one side more. Yes, I mean, some people are in symmetry, perfectly symmetrical, but you'll be surprised how few that is if we look carefully, pay great attention to detail. So if you're habitually crossing one leg, my suggestion would be reverse, try the other one. And that applies to any sport where you're playing one side, like habitually playing golf one-way golf swing. Borrow a left-handed club, reverse the swing. Habitually playing squash or tennis, habitually playing hockey, one side, reverse it, try the other side. Feels really weird, but it will maintain and work with any muscle imbalance. So coming back to twists, you have chairs in your office. Very simple. This is a spinal twist. So all I'm going to do is go into the twist. Now that, for me, is in the hip. You may feel it in your back. The idea with a spinal twist is try to stay upright. And there's the twist. There's the twist. There's a lot of massage through the gut, through the internal organs. I have a big tummy. I pull it out the way, but I can feel quite a wicked stretch through my left piriformis and glutes. So I'm going into the restriction, into the awkward side, because I know I'm tighter this way around. Of course, human nature being what it is, we always think we're doing better because we can go further on the easy side. But what is the point in that? Because it's not a competition sport. It's not how far you get. That's utterly irrelevant. What matters for your own personal training is to work on the weaknesses, not the strengths. To work on the restriction, so at least work on the awkward side, at least as much as, if not more than, the easy side. And the same with all the other variations, the modified pigeon. The modified pigeon, if camera comes here, you want to see? The modified pigeon is the lunge, where I go into the modified pigeon with this knee at a 90-degree angle, and this is my good side. So I'm getting quite a wicked stretch through the right piriformis and the butt and the glutes. But this knee has to be at a 90-degree angle, and I can feel immediately, as previously, that's the looser hip, and this is the tighter hip. So here we are. So that's another variation, what I call the runner's stretch. What most of you will do is to pigeon, but once you bend that knee to 45, you'll lose it. There won't be anything happening in the piriformis, so we take this knee to 90 degrees. So there is the forward lunge. Of course, you may want to stretch out the hip flexors as well, and that's what the lunge is for. And always with the lunge, tail down, pubis up, to make it a core exercise. Tail down, and immediately that throws it to the back leg. So from a lunge, I could go from hip flexor on that side to piriformis on this side, modified pigeon, with knee at 90 degrees, not 45. And I'll show you that in reverse. Tail down, pubis up. But for runners, anytime, any place, anywhere, that's your stretch. Supine in the gym, mat work, that's your stretch. The cross twist stretch this way is doing the same thing. That's your stretch. Come over here, camera here, because you won't see. So that's the stretch pulling down piriformis. That's my tight hip, but be curious, one side is tighter. And with all of these things, work with intelligence, never push through the pain. Find out the restriction. The chair is there in the office because most of you are going to be sitting like this, or one leg. Reverse the cross. How else are you going to maintain the muscle, enhance, improve any muscle imbalance, which most of us will have. But that's enough to work with. Make it your own. Experiment. Enjoy that. Stop if it hurts. Be gentle.